our poster focuses on the relationship between cardiorespiratory fitness and phase angle in cancer survivors. To start, phase angle is a measure of cell membrane integrity and is used as a prognostic component of cancer survival. Low phase angle values are linked to increased mortality and decreased muscle strength. High phase angle values are linked to increased cell health and survival. Improving phase angle among cancer survivors improves quality of life, survival rates, cell health, and integrity. At the moment, there is limited research on which major component of exercise, those being cardiorespiratory fitness, upper body strength, or lower body strength, improves phase angle the most. Understanding which major component of exercise plays the largest role in improving phase angle is essential when creating high-quality exercise interventions for cancer survivors. The purpose of this study is to analyze the relationship between phase angle and the major components of exercise.
Our methods primarily relate to the Carroll University Rehabilitative Exercise, or CURE program. This is a program where the Masters of Clinical Exercise Physiology students create and run a comprehensive 12-week exercise intervention for those who are undergoing or have completed cancer treatments, as well as those with a multitude of chronic conditions. At the time of this presentation, we've collected data from 73 different cancer patients, with that number actively growing each year. On the initial day, patients complete pre-exercise assessments, including a VO2 peak test to assess cardiorespiratory fitness, upper and lower body strength assessments, and an in-body analysis to collect phase angle and other body composition values. After initial assessments, our exercise physiology students prescribe a 12-week intervention, including frequency, intensity, time, and type of exercises, including homework to be done on the weekends. Following the 12-week intervention, the same post-assessments were completed, and improvements in the major components of exercise were analyzed using paired sample t-tests. The relationship between phase angle, cardiorespiratory function, and muscular strength were examined using Pearson correlation. Simple linear regression were used to determine components of the prescription were most predictive of phase angle.
Table 1 shows our participants' demographic information as well as how many participants were in each of the 4 phases of cancer rehabilitation using Dr. Jessica Brown's phase program. Phase 1 consists of patients undergoing chemotherapy and/or radiation, with the time frame of this phase being however long a specific patient is in treatment to 1 month following treatment. Phase 2 consists of cancer patients who have graduated from phase 1, those who are not undergoing chemotherapy or radiation, but other types of cancer treatment, such as surgical or hormonal treatment, or those who are entering cure following the end of their treatment. Phase 3 includes patients that have graduated from phase 2 and marks the end of true cancer rehabilitation. The primary focus of this phase is to improve physiological and psychological function through progressive overload in order to reach apparently healthy status and to encourage patients to build intrinsic motivation and self-efficacy with exercise. The lengths of phases 2 and 3 are each 12 weeks. Finally, phase 4 includes patients who have graduated from phase 3 and are in the maintenance phase of exercise. The goal of this phase is to develop habits of lifetime physical activity, making the time frame of phase 4 infinite. Figure 1 shows the percentages of each cancer type seen within the 73 patients in this study, with the most prevalent type being breast cancer.
Our study found that regarding all major exercise components, there was a significant increase when comparing pre and post values. This is shown in the bar graphs on Figure 2. VO2 peak, upper body, and lower body strength improved 12.8, 22.2, and 27% respectively, with a p-value of less than 0.001. Prior to the 12-week exercise intervention, 19.5% of the proportion of variance in phase angle is explained by the combination of cardiorespiratory fitness, upper body, and lower body strength. Following the 12-week exercise intervention, 27% of the proportion of variance in phase angle is explained by the combination of cardiorespiratory fitness, upper body, and lower body strength. These numbers show that phase angle is affected by the major exercise components, and following the 12-week exercise intervention, phase angle is even more greatly affected by the components. Although all 3 exercise components have a significant influence on phase angle. When looking at figure 3, we can see that cardiorespiratory fitness is correlated 35%, R equaling 0.353 with phase angle, and that correlation grows even stronger post 12-week intervention with a correlation of 45%, R equaling 0.452. This can be seen when looking at how the orange oval gets tighter to the line of best fit, demonstrating the correlation growing stronger. This is statistically significant with a p-value less than 0.001, suggesting that cardiorespiratory fitness has the greatest effect on phase angle.
The aim of our study was to examine the relationship between phase angle and the major components of an exercise program. Cancer treatments often cause toxicities that impact cellular health and physical function. These toxicities often compromise the major systems in the body, including cardiovascular, respiratory, musculoskeletal, neurological, immune, and gastrointestinal. These impairments ultimately lead to a decline in phase angle, a measurement of cell membrane integrity, with cardiorespiratory fitness producing the most significant improvements in cancer survivors. This is related to the multi-systemic effects cardiorespiratory fitness contributes to combat respiratory, cardiovascular, and musculoskeletal toxicities that treatments of all cancer types cause. This study demonstrates the pivotal role the major components of exercise have on improvements of phase angle, specifically cardiorespiratory fitness. Cardiorespiratory fitness was the major predictor of phase angle improvement because it encompasses full body engagement to create substantial multi-systemic improvements. We suggest a comprehensive exercise program aimed at enhancing phase angle should include all major components of exercise prescription, encompassing both cardiovascular and full body strength training. However, phase angle improvements are better linked to gains in the cardiorespiratory system.
We would like to give our professors, Dr. Jessica Brown and Dr. Daniel Shackelford, a special thank you for helping us with this research and their effort in our education over the last 2 years.